Medical and Public Health Services in Karnataka. This is an introductory essay on medical and public health services of Karnataka. In this, we will discuss about the early practice of medicine and present health administration and medical research in the Karnataka state. We will start with the Ayurveda system. The Ayurveda system of medicine has been in practice in Karnataka from earlier times. Several Ayurveda Vaidyas enjoyed royal patronage. In every village, there were at least one or two families capable of offering relief to the patients with the help of herbs. Then there was a Unani system of medicine that was introduced around 14th century during the Muslim rule. The Unani physicians, known as Hakims, enjoyed the confidence of the Muslim rulers as well as the general public. The Badami king Ahmad II ordered the construction of a splendid Shafa Khan at Bidar, which attracted patients from all communities. Homeopathy, yoga, naturopathy, and Siddha systems were also in practice. Now let us take a look into the health administration in the erstwhile state of Mysore. Let us see some important features. They were: number 1, 4 hospitals and 24 dispensaries under the British administration were handed over to the then government of Mysore in 1884. 2. A medical college was established for the purpose of training hospital assistants. 3. In 1907, the reorganization of health services took place and a public health department was created. 4. In the Mysore state, a board of health was appointed in 1929 to act as an advisory body on the public health matters. 5. Mysore state was the first in the country to establish rural health centers way back in 1931 itself. 6. A Bureau of Maternal and Child Health and Bureau of Malariology were started in 1934 and Health Training Demonstration Center was opened in 1936. 7. The world's first official planning clinic was also established in Mysore in 1930. 8. The University Medical School in Bangalore was started in 1917 and in 1924 the first medical college was opened. Therefore, it can be seen that the Karnataka had a good record of medical education and medical system in the early times. Now let us see health record system that is prevalent in Karnataka. To begin with, there is a registration of births and deaths, and it is playing an important source of demographic data for the socio-economic development and population control in Karnataka, as is the case in the developing countries. The data on population growth, fertility and mortality services are the starting point for the population projections. In order to unify the civil registration activities, the Registration of Births and Deaths Act of 1969 was enacted. There is a joint director, the deputy director and the assistant directors who are in charge of the vital statistics as the joint chief registrars. Now let us see the process of birth registration in Karnataka. There is a Karnataka registration of birth and death rules in place. In the rural areas, the village headman even earlier acted as the registrar till 1978. In the urban areas, the city corporation or the city municipal councils, notified area committees, health officers, sanitary inspectors, etc. are the registrars. In some large cities, sub-registrar of births and deaths have been appointed for different areas to decentralize the work. In rural areas, the village accountants now are the registrars. Sample registration system was introduced. Sample registration system. Office of the Registrar General of India initiated the scheme of sample registration of births and deaths in India, and it was popularly known as sample registration system. The main objective of this sample registration system was to provide reliable estimates of birth rate, death rate and infant mortality rate for the rural areas and the urban areas as per the National Sample Survey. Data for other measures of fertility and mortality, including total fertility, infant and child mortality rate at the higher geographical levels, was also collected. And there was a system of medical certification of cause of death. This scheme of medical certification of cause of death was introduced in the country under the provisions of the Registration of Births and Deaths Act of 1969. Section 10(3) of the Act provides for issuing a certificate of the cause of death by the medical practitioner, and he should be the one who attended the deceased at the time of death. Medical research. Medical research is currently facing a stiff challenges from the spread of a variety of ailments like cancer, AIDS, heart diseases, juvenile diabetes, non-communicable diseases, swine flu, and chikungunya, etc. The international community of medical professionals under the aegis of World Health Organizations have codified most of the diseases, labeling them as International Classification of Diseases. The International Classification of Diseases is customized to the Indian conditions under the scheme Medical Certification of Cause of Death. Important demographic indicators like infant mortality rate, maternal mortality rate, and child mortality rate are derived using the information on medical certificates. Now let us see the overall findings of such reports for Karnataka. Now during the year 2011, following 8 leading cause groups of deaths constituted around 88% of total deaths. Let us see the details. Now the diseases of the circulatory system contributed nearly 30%. Injury, poisoning, and certain other consequences of external causes of death were 11%. Certain conditions originating in the prenatal period accounted for 9.3%. Diseases of the respiratory system which caused the death accounted for nearly 8%. Diseases of the digestive system contributed 6.5%. Endocrine, nutritional, and metabolic diseases contributed around 6%. Then there was a neoplasm which contributed deaths to an extent of 6% of the total deaths. Now we come to the end of the essay, and the important points to remember in this essay are: Karnataka has had early history of medical and health system. The Unani system and also Ayurveda medicines were introduced quite early during many Hindu and the Muslim rulers. Mysore state is the first in the country to establish a rural health center in 1931. World's first official family planning clinic was established in Mysore in 1930. The University Medical School in Bangalore was started in 1917, and in 1924 the first medical college was also opened. The Registration of Births and Deaths Act of 1969 was enacted to unify the civil registration activities, including births, deaths, and the related informations. The scheme of medical certification of cause of death was introduced in the country under the provisions of the Registration of Births and Deaths Act of 1969. Section 10(2) of the Act empowers the state government to enforce provisions relating to the medical certification of cause of death. Further, Section 10(3) of the Act provides for issuing a certificate of cause of death by the medical practitioner who attended the deceased at the time of death.